local television network, TSPN. And now back to Today's Seniors Living Well with your host, Laurie Webb.
Hi everyone, welcome back to Today's Seniors Living Well. This is our 6th series that we've done covering the resources and programs in Amador County. And we are focusing on solving the puzzle of aging these days because there's so many pieces to that. And we just had a nice conversation with Nancy Rogers and Nancy Ralph and Harlan Rader from the New Horizons program. But before you make use of any of Denari's services, sometimes you end up at Debbie's place, which is Kit Carson.
Nursing and Rehab.
Nursing and Rehab. Nice to have you back on the program.
Hi, Laurie. Good to be here.
So what's new at Kit Carson these days?
Well, we have some new and upcoming news, and we're going to be starting a new division, which is a subacute unit. And subacute is when you're no longer appropriate for the acute care, but you still have a complex medical condition that needs more skilled services than you basically get in the nursing home. Mm-hmm. So they call that a subacute, where you can do trach care, vents, more higher level, and get more extensive time under the acute level. That's why they call it subacute. So that's up new coming.
Yeah.
It's not yet there. We are doing the plans, but we will be opening and announcing that, so maybe I can come back when we do have that service.
That'd be great.
Yeah, and what will be good about it is in the community in the foothills here, there is no subacute. People are transferred down to the valley, to the Bay Area, and when Northern California is full, they will transfer loved ones down south.
Oh my.
So this will be a big thing for the community, as well as the other communities surrounding us on the foothills, that they can keep their loved ones up here close for high complexity care.
That's great.
Yeah.
I am familiar with the Kindred care chain, and they have a lot of subacute focused on ventilator patients. And I know somebody from Amador that had to go all the way down to Southern California because there was no place for them to be cared for.
Exactly.
So that'd be fabulous to have it right here in our home.
Yes, so we have hospitals in Sacramento, up here in the foothill regions from Tuolumne County to Placer. Very excited for our new news coming. And so Kit Carson being a 199-bed facility, for the last years we haven't been able to use the whole building to utilize it, because now we have assisted livings, people living at home or boarding cares. And the design of the building was long-term care mixed with assisted living when it was built.
Right.
So now we find what the community needs and where we're going with it, and that's where we came up with subacute. So I'm hoping to see more results by the end of this year. Might be up and going. So as soon as I do have those, dates, then I can come back, revisit it, and tell more to the community what we have to offer them.
That'll be great. As a nurse, I see sometimes that kind of sad thing where somebody will come home because that's really the only place they want to be, and we do the best we can with home care, but there's just times that they really need to be in a hospital and have that kind of 24/7 skilled care. So.
Yes, and so that's still what we'll be offering. We will be offering still, of course, our rehabilitation unit.
Which is a great going concern.
That's the short-term rehab that we offer. We do now take, which is really nice, commercial insurances. We're working with Cover California.
Oh, great.
So my job is really opened up to a lot of doors to help more people in the community with different insurances. So we're not just Medicare, Medi-Cal facility anymore. We are doing commercial and managed cares also.
Wow.
Yeah, so we really have opened a lot more of our avenue to help more people in our own local that might have signed up for managed care or have a commercial, might be a little bit younger, but in for a surgery that wasn't expected. Then we can help them with their commercial insurance.
Right. Yeah, we are aware that there's a demographic here in Amador County of people that are not Medicare age yet, but are getting hips and knees and other kinds of joint replacements, and then they need the rehab, and it's really great to have the rehab unit. Having had personal experience with family members at that rehab unit, I know how great it is.
Yeah, we're very fortunate to have the rehab that we do, and we're also purchasing new equipment for our knees and our other devices that we can use. So I'll be coming back with more news about that, and maybe bringing the rehab department with me to tell you where we're going with the new and upcoming changes in our rehab, which is becoming even more high tech. What we can offer for the rehabilitation end to get them further along with these new devices out. Yeah.
And it sounds like when, I know in the past people have like, well, I'm not on Medicare and I'm not on Medi-Cal, so I can't go to Kit Carson. But now they need to be aware that there's been changes in
Yes.
that, and
They
they
just
need
call
to
me
come-
up, that'll verify what their insurance covers and go over their insurance with them and see what services are provided and what, like their deductibles out of pocket and explain how it works to them. Yeah.
Yeah, because you're very good at that. You have a lot of information about that.
And I'm learning with this new California, all the new changes.
yeah,
Everyone's
there's-
learning a lot, but we're in it together and to help the community.
That's great. And I know there's been a bunch of changes in Medicare too.
Oh, yeah.
And you guys have to keep up with all those kinds of things.
Yes,
Yeah.
exactly.
So, and you were doing hospice for a while. You had a contract with
We
hospice.
still do.
Oh, okay.
We still offer, Amador County's hospice program. Yes. We offer still respite care, short-term breaks for caregivers, loved ones they might need a person taken care of for the 24/7 while they're out of town. Sometimes just even a break, because caregiving is a very big job when you do it. It's around the clock.
I have, in our caregiver support group that we had a gentleman that needed a break, and he brought his wife to you, and she liked it so well there that she told him that's where she wanted to stay. You guys were taking better care of her.
Yeah.
So that respite program is really, really valuable.
Yeah.
And he didn't think he could afford it, but his kids knew that he needed it so much that they helped
Pitched
him.
in. Wonderful.
So that's really
And then we
good.
still do long-term care, which we work with long-term care policies, Medi-Cal, or, just private pay. And anything anybody wants to know, they just inquire, call me at Kit Carson and inquire through me.
Right.
Yeah.
Because this is the Debbie. She's the one that gets people into the hospital, and then we've got the other Debbie that's the discharge finder.
Yeah, we have
So-
Debbie in and Debbie out,
Debbie
as they
in
call
and
us.
Debbie out, yeah.
Yeah, I
So-
bring you in and I work
Yeah.
on the cases to bring patients in, and then she does the discharging and works with our local home health agencies to set up after discharging from our rehab some support services.
That's great.
Yeah, so
that's
there's a couple
wonderful.
Debbies running around Kit Carson.
Yeah, so be sure you ask for the right one, or you'll be out before
or
you get
you'll
in.
find one of us that
Yeah.
can help you, you bet. Yeah.
How's the community involvement going? Are you still getting volunteers, groups from the community coming in and
Yes, we
helping
do.
out with
We
activities
do, but
and
we can
things?
always use new volunteers. Anybody that feels it in their heart that wants to come in, and there's different things you can do with volunteering. There's just a lot of different aspects. So find out what it is inside yourself, and if you feel like you want to participate, and it's really great to make relationships with people. As you know, working at the senior center, your life is enriched with more family when you do get involved.
Right.
Yeah.
And having had several people come to me and say, so-and-so is in the room with my mom, and she doesn't have anybody visiting her at all.
Yeah.
I'm like, well,
Companionship.
you could visit her.
That's right,
Yeah.
companionship.
Yeah.
Sometimes just reading to somebody or sitting outside in the courtyard with them, spending some time. Yeah. And then also they can work with a group of people. We have volunteers that call out our bingo, different things that they can interact. They can, give up as much time as they want to give. It's not a commitment or a contract.
Right. Just come in when you
Well, you
feel-
go through activities and we will screen people, but yeah, you'll set up a program that you would be willing to do in your time frame.
And if they wanted to do that, who would they talk to?
Jeannie Ritchie, actually.
Jeannie's still there, yeah.
Yes, Jeannie
Bless
has
her heart.
30 years.
Yeah.
30 years in the industry, yes.
I think she was a CNA when I
Yeah, she
when I
first
was
started
working
CNA,
there, yeah.
and she's been our activity director for at least 20 of years.
Oh, a long,
Yeah.
long time.
Yeah.
She does great stuff. And I know that sometimes, like a Girl Scout troop will want to come and like put on a party or something,
And that's
they
fine,
would go
too.
through.
Yeah, we've had even senior proms. We've had all kinds of crazy fun stuff. Karaoke. I mean,
Karaoke
yeah,
at
so there's a
Kit
lot of
Carson.
fun,
I'm
different things
surprised I
that you
didn't
can
know
do
about
because
that.
people are still alive and want to do things. They're active. They might have some challenges, but they're like us. They need companionship. They need some laughter. They need some fun.
One time, one of the folks from Kit Carson came on the show, and he was talking about how people shy away from the term nursing home. But he said he didn't shy away from that term because for some of the people, that is their home.
Exactly.
And the goal was to make it as home-like and comfortable and as, safe and comfortable and interesting as possible, because that it was going to be the home for the rest of their life. And I thought that was an interesting perspective because we were kind of shying away from that term.
Yeah.
But let's face it, it's 5% of the people, that's where they end their lives.
Yes.
So,
Yes.
yeah.
And some people, it's a choice. I've had calls where people call up and want to come look and let me know that they're not wanting to do it alone anymore, live alone. They, for their meals, their meds, just having some extra help. And, you know, so sometimes it's a personal choice. Sometimes it's a caregiver that no longer can do it. Now their health is suffering. And they then call me and we talk about options in our community, whether it's us or other, you know, resources, and find what's best for them because maybe they just can't do it anymore.
Can't do it anymore.
Yeah, and that happens.
And how would they get a hold of you?
Well, they can call us at 223-2231. I'm extension 41 for admissions.
Okay.
And that's how you get a hold of us.
That's-
Right here locally in the community on 811 Court Street. You can't miss us on the corner.
No, right there, and plenty of nice parking in the back parking
Yes,
lot.
off of New York Ranch.
Yeah,
You bet.
yeah. The visiting and touring, that's something that they should set up during...
Set up a schedule. Yeah, I have
Yeah.
a schedule and I set time away
Okay.
for tours. And if I'm not available, the social services or other designated persons will. But yeah, call us up so we can set some time aside to talk about what they want to talk about and check out our facility.
Right, and they can actually walk around and, you know,
Yeah,
look
and
at a
sometimes
room
just
that's empty
looking
or
at things
something.
ahead. Maybe you don't know you have a loved one that lives out of the area, and mom's not going to be able to live alone forever. You're seeing some things that are happening. You want to relocate, so then you would just maybe call for a tour of the facility, find out the information of how you would place somebody.
Great.
Yeah.
Okay. Well, thank you for being here. We
Yeah,
look
good to
forward
see
to
you
having
again,
you
Laurie.
back.
Yes.
And we'll hear about the subacute.
Yes.
So everyone stay tuned, and we're going to go to a break and then visit with a very active local senior.
You're watching Amador County's local television network, TSPN.